Okay.
Good morning.
Good morning.
How are you, Doctor?
Very good. Good morning, Paul. Good morning to everyone. I want to make sure that I have a chance here to welcome everybody, and especially Paul Hiltz, who's going to be our speaker this morning. I want to take this time to thank you all for showing up in a virtual way. This isn't the normal way that we do things here at Naples United Church of Christ, and we're usually in a wonderful auditorium with coffee and donuts and enjoying our mutual time together, but I think we can still do a similar thing in this virtual way. I'm a member of Naples United Church of Christ, and have also been on the Committee of Aging Well. We started this about 7 years ago, and this is actually our 6th season of having our Aging Well series. The Aging Well series is really based on what members and friends and those that attend these meetings want to see. And in this case, we actually have based our talks then on a little survey. So just as a bookkeeping item here, or a housekeeping item, I'd like to remind you that there'll be a very short little question asking if you've attended before, and you can see that coming up. I can punch all of them, I guess, so that I have attended all of these and submit it. So we want you to do that kind of thing, as well as during the program will be another short little question like that. But the most important thing at the very end, even if you have to leave early, we'd like all of you who are viewing to, as you check out, there'll be again just a short little spot to fill in a couple of ideas so that we'll know what kind of talks you'd like to hear in the future. So the survey is very, very important. We're also today coordinating this, that we want to have our speaker have plenty of time to present his material uninterrupted, and therefore we're going to be having Q&A or questions asked at the end of his talk. Therefore, if you have any ideas or questions, you can find a Q&A button on some computers down below or up above on an iPad. You can put those questions in, and I'll be monitoring those to ask those at the end of our talk here. So that's very important. And then finally, for those that might not be able to have friends or relatives attend this or would like to have them see this, it's being recorded and archived so that this can be reached through our Naples UCC YouTube channel. You can go to that. I'll remind you at the end how you can get that too. So we want to make sure that you understand that there are various ways to get into this, and we appreciate our audiences over the years and the wonderful speakers that we've had. So with that, I want to take a minute here. I'm sorry we're jumping into Paul here so abruptly maybe, but we are very, very lucky this year to have Paul Hiltz to present to us our kind of keynote talk for the series of 3 that we're having this year, and I'll go over those later as well. But Paul came to Naples in July of 2019. He is the president and CEO of the NCH health system. He had a similar position in Canton, Ohio at the Mercy Medical Center, and also in Cincinnati. His training goes back into 1983, getting a master's of health and hospital administration, and also attending Xavier University in Cincinnati. He's also a fellow of the College of Healthcare Executives. He has a very unique way of handling things. I was very lucky to have heard him in person before all this COVID business hit. And because of that enthusiasm as a wonderful speaker, I just knew we had to have him as part of our Aging Well, and he was so wonderful to agree to do so. So I can't thank you enough, Paul, and I'm looking forward to hearing you again. So thank you very much for doing this.
Well, thank you for having me, Bob. I really do appreciate the opportunity. And the Aging Well is a great topic to talk about in the midst of COVID, because I think what we're going to find out when the dust settles and we look at the data behind this region, we fared much, much better than most of America in terms of the incidence rate and the survival rate of COVID here in Southwest Florida. There's a lot of theories as to why that might be, but certainly I think one piece of it is that people in this region do take care of themselves as they age. And I think the other thing, and it's in terms of the Church of Christ, just the social piece and the being a part of a spiritual community, I think is going to be found to be very, very helpful and important, and a theme that I've seen play out throughout this pandemic. So it's a perfect start to this talk. So wanted to talk a little bit about how we're doing in COVID as a community and what the future might look like for this region and for NCH and for all of us as consumers of healthcare. So last year, when I started here, I talked about I was going to focus on 3 C's: community, collaboration, and cooperation, as I think those are 3 things that are critical to a health system, especially NCH. I left off the 4th C, which was COVID. We didn't really anticipate that we'd have a global pandemic. But let's talk about that. We, since the beginning of this pandemic here at NCH, we've actually, believe it or not, sent out 60,000 specimens for testing. So some people were tested more than once, but 60,000 tests. We've had over 2,000 inpatient COVID patients here, and hundreds of others that we treated on an outpatient basis and sent home. But that's a pretty robust service to treat 2,000 of these COVID patients. And how did we do? So we're proud of how we did, because we've submitted our data into a national study along with Mayo. Our Mayo Clinic affiliation here turned out to be a really big deal, because our COVID clinical team was in touch with the infectious disease chief at the Mayo Clinic on a weekly basis. So we were able to keep up with what the worldwide data was saying was working for COVID patients. And one of my big roles, and our role as a team here, was to make sure that we didn't run out of beds, we didn't run out of ventilators, and we didn't run out of the medicines used to treat COVID. And I'm pleased to say we didn't run out of any of that. We were able to get the remdesivir, which you probably have heard of. The Regeneron is the one that President Trump took and helped in his recovery. We've always had enough Regeneron. That's the monoclonal antibodies. And then we've also, thanks to a very generous community here, we've had enough of the convalescent plasma. That's the blood from people that have recovered from COVID. So we've had the entire armament of medications and treatments to treat COVID. At the beginning of the pandemic, we actually went out and bought several hospital-grade tents in case we would have run out of capacity. We didn't need to put those up, as it turns out. We were able to reverse engineer some of our hospital rooms. So we had negative pressure. We called it a hospital within a hospital here at both campuses. So we took COVID inpatients, put them on one unit in each hospital, used negative pressure to keep the germs in that room. And all that really, really worked, because we, throughout this whole pandemic from March until now, we've only had 1 patient infected by another patient, and we've only had 2 employees infected by a patient. And that's really remarkable. And as I've looked at my colleagues around the country, those numbers are going to stand out versus any health system in America. So we've taken incredible precautions to keep the staff safe, to keep the doctors safe. We had multiple community members who donated money to help us to acquire enough of the PPE, that's the personal protective equipment. And we were able to buy 13 of the germ zapping robots that are used in between patients in the room. And those robots kill the coronavirus, and they kill C. diff and MRSA, which are 2 other big infections that can kill people in a hospital. In fact, an interesting thing, not only did we kill the coronavirus, last month, for the first time in history here at NCH, we had 0 C. diff infections for the entire month. And that is just almost unheard of in a hospital. So lots of good infection control, lots of good teamwork and camaraderie to help take care of this community. The other interesting thing that your members will, I think, be interested in and probably not surprised by, but it's the generosity of this overall Naples, Collier County community. We tallied it up recently. We've received over 40,000 free meals for frontline caregivers from local restaurants, which I just almost find hard to believe, but and they continue to come in. And you can imagine that the caregivers are somewhat exhausted now, having gone through this for the last 10, 11 months. But those meals, the cards, we've had donations of PPE, we've had significant financial donations. All that really has been a shot in the arm for our doctors and our nurses and other frontline caregivers. And it says a lot about the generosity of this community, I think, as to and how we've kept things going. Because one of my big fears at the onset of this pandemic was, would we be able to keep our staff here? I worried that, because of the highly infectious nature early on of this thing, we knew it was highly contagious. We didn't know how lethal it was, but I worried that our caregivers would just bolt. And that turns out, thank God, that didn't happen. We've gone through the whole pandemic without furloughing any employees, without terminating laying anybody off, without cutting anybody's pay. So we've tried to do a good job of taking care of the people who are taking care of our community. And I think we've really turned the corner. Now we received enough vaccinations to vaccinate most of our employees. Some employees opted not to get the vaccination. Most did. So we've used up the 4,600 vaccinations that we were allotted by the governor. And this community is now starting to get vaccinated. So I do think, just a little inside thing, it's kind of interesting. You hear stories about frontline heroes, and we use that term. And it turns out, I really think these healthcare heroes are truly heroes. And I'll tell you why. As I've rounded through the hospitals, I got a chance to watch on the COVID units how it is to take care of a COVID patient. And turns out that many of the COVID patients do best when they're on their stomachs, when they're in a prone position, and they typically stay on their stomach for 17 hours, and then they're flipped for the other 7 hours onto their back. Well, to do that flipping of a patient, I observed this many times, it takes about 9 staff members to do that, because the patients are on ventilators, they've got IVs and all kinds of monitors. So to get one patient turned, it takes about 9 people. Those 9 caregivers have to put on the protective garb, go into the room, spend 20 minutes or so getting the patient comfortable and situated. Then they have to take all that off, go to the next room. So you're constantly what they call donning and doffing, putting clothes on and taking clothes off. And it's physical exertion. So there's a certain amount of exhaustion, and there's a certain amount of fear on the part of these caregivers, because you think they're taking care of these critically ill people. So the day that we first started doing vaccinations here on our staff, I would say these buildings were just euphoric. The people that were the caregivers, I don't even think realized how much fear and anxiety they were carrying with them over the course of many months. And I think that lifting of that anxiety is something that our whole community will soon begin to experience as the vaccinations roll out in a bigger way. I know we're all frustrated at the pace and the uneven distribution of the vaccines. And I know everybody's trying at every level to do the best they can. It still is the fastest this country's ever rolled out a vaccination. So we've got to keep that in context. And I think if we can hold on to our patients a little longer as the vaccines become more widely distributed, we'll see that whole anxiety lift from our Southwest Florida region. And that'll be a really good thing. On the NCH part, we have the Moderna vaccines. That was the first shipment. We've not received any since then. I did send a letter to Governor DeSantis yesterday requesting additional shipments. We have bought the 2 freezers for the Pfizer vaccines. If we could get Pfizer, we would take those, or the Johnson & Johnson. So we're open to anything, and we'll try to be a good community partner to distribute those vaccines as they become available. But all in all, we feel good about the performance here. We know that our mortality here is lower than it has been across the country. The length of stay for COVID patients has been shorter than patients across the country. So lots to be proud of here. We've had a team, what we have called the COVID response team, led by Dr. David Lindner, who's a pulmonary critical care specialist. He has led our team and really used evidence-based medicine protocols to treat COVID. Lots of great outcomes there. And it's been one of the hallmarks of our team here throughout this whole thing. And we'll continue to do that. We partnered with the city of Naples. We've produced and distributed now, if you can believe this, over 600,000 of the masks that say NCH on them. And we've continued not to lobby for any ordinance or anything like that, but we've continued to just tell people that based on everything we know at NCH and in these hospital settings, the masks have had an impact on spreading or slowing the spread of this disease. So we've tried to tell people that it is a good thing as we continue to roll out the vaccine, to continue to social distance, continue to mask, and so forth. So that's been our COVID response. And we, like I said, we feel good about how we've performed to date. We're going to continue to be vigilant and continue to educate and continue to do all the things we can to get us back to some semblance of normalcy here, where we can, instead of being on a Zoom, we can be together in a room. So what will it mean for the future of our region? How will COVID change? Well, a couple things we think will live on for a long time. We do think that one of the things we've learned is that cooperation between and among healthcare providers and networks is going to be vitally important. So the public health system, the county health department, and the hospitals, we can do better going forward to communicate more consistently. We think we can do better with groups like the Neighborhood Health Clinic, like the Health Network of Southwest Florida. I think our patients, our residents here want healthcare providers to work together and not to compete. So Lee Health, NCH, the Health Network, we're all talking a lot more frequently than we ever have in the past, and we'll continue to collaborate and work together to provide more and better care to people here in this region. We think that the Blue Zones project is a big piece of the success here in terms of aging well. We now have, we're in the 6th year of our commitment to Blue Zones. We now have over 700 businesses participating. We'll continue to promote all that is healthy lifestyle advice through the Blue Zones, because we think that aging well is really an important part of our mission here. And we'll continue to do more and more of that. And it's right in line with what you're doing. So the cooperation piece we think is going to live on. Number 2, we think that telemedicine is here to stay. That really took off during the pandemic, and we have no doubt we're learning that some things are better suited to telemedicine than others, but for sure, we do believe that telemedicine will be here for a while, and we'll continue to promote better, easier access to healthcare across the board. So the footprint of NCH from Bonita Springs down to Marco Island, we're going to continue to expand the footprint, knowing that most folks like to get their health care close to their home. They don't like to come to a hospital. They don't want to be in a hospital. And we'll try to help people accomplish that goal. If you need to be in a hospital, this is a great place to be. But we try to keep people out. We try to keep people having easy access to their doctors and their other providers. So those are some of the themes we see going forward. And a couple of other things have emerged through this pandemic. Doctor, for you and your team, you might be interested in. People have said, gosh, Paul, since you came in this pandemic, is that all you've worked on 24/7? The answer is thankfully no. We've continued to do a lot of things that we were going to do anyway. One of them that we think is really important for the listeners here is the idea of we are switching to a new electronic health record. It's called Epic. It's the largest health record in the country. And so it's why it would be important to our participants this morning is if you travel, if you have a home in the north somewhere or anywhere outside of Florida, and you go to any big health system, I'll just give you a few examples. If it's Mayo, Northwestern, Cleveland Clinic, Johns Hopkins, those kind of systems, they're all on the Epic system. So once we implement this fully, which will be about a year from now when it's fully formed, you'll have one record that will go with you wherever you go. Your doctors can look at what medications you're on, what procedures you've had when you've been in the hospital. They can communicate back and forth with you. They can coordinate care here in Naples from the Mayo Clinic, if that's your or MD Anderson or wherever you're being treated. We think this is a big, big quality improvement for patients that travel in and out of Southwest Florida. It was about a $70 million investment, but we felt that it was vitally important to people's health. We'll also be able to use that Epic to communicate and track patients' healthcare across the continuum. So we can send alerts to people. And again, we may face another pandemic in our lifetime here, who knows, but it would be a better way for us to communicate breaking news about what the best care is for the next pandemic. So Epic is, we think, a big, big deal. The second piece that we've worked on and now have implemented is we have formed a joint venture company with a company called ProScan here in Naples. It's an imaging company. It's based in Ohio. It's one of the largest imaging companies in the country. And with us forming a joint venture company makes us the largest provider of imaging here in Southwest Florida. So if you need a CT scan, an MRI, mammography, plain x-rays, PET scans, we'll be the largest provider. We have purchased the Watson artificial intelligence technology to put into this joint venture. So we believe that we'll have the highest quality imaging service that you can get anywhere now going forward. We think that's a big deal. Another big initiative that we've undertaken here, you may have followed, we recently purchased the Naples Daily News building and the 10 acres of property around that. We'll use that building to move our back office employees from our existing building on Pine Ridge Road up to the Naples Daily News building. It's significant because the new building, the Naples Daily News building, is hurricane rated. We can have our IT systems there safely. We won't have to outsource those to another state. Our employees will be in a better protected building in an area that's of strategic importance to us. And the 10 acres of land, we envision doing something very unique up there in conjunction with Arthrex. Arthrex is, a medical technology company, which is one of the most innovative really in the world. They've got 1,300 patents today for medical technology. And they are the market leader in some of these total joint replacements for shoulders. And we really feel that a strategic partnership with Arthrex will be an important piece for us. And we did get that closed. Another big innovation that we've launched this year, we received a $5 million gift to start a simulation center, which will be opening in the next couple of months. A simulation, if you're in aeronautics or in the aviation business, simulation centers are used to train pilots, but it's now becoming much more common to train doctors, nurses, and other clinicians are using simulation because these lifelike mannequins have heart rhythm problems, respiration to train these young upcoming doctors. And we'll use that with our internal medicine residency program and with our practicing doctors to make sure we've got the best trained people here. When it comes to the internal medicine residency too, we currently do this in conjunction with the Mayo Clinic. We train 36 residents, 12 per year, but we've decided to expand that now. We'll do 18 residents per year. And just so the folks on the video today know that it's a very, very popular residency because of Mayo's involvement. This last year, we had 2,000 applicants applying for 12 slots. So we think it's a big, big deal for Southwest Florida and our ability to train these great primary care doctors. Another big initiative that we've undertaken, we just announced it this week, is a partnership with a company called Ensemble. It's the largest revenue cycle provider in America for hospitals. It's based here in Naples. Revenue cycle is kind of a fancy word that just covers all things related to billing. It would be important to the listeners here because what we intend to do is really improve the overall accuracy of our billing process and to make the customer experience much nicer, because we all know hospital bills are complicated, lots of paperwork. This company is going to help us streamline that and make it understandable to the patient and make it very accurate. And we think that'll be a big partnership for us. We'll be focusing going forward on a couple of key clinical services and we haven't missed a beat on this. Number one, last week we opened phase 1 of our $30 million renovation of the emergency department. Phase 1 was the second floor where we have observation unit there for people that come to the emergency department and the doctors want to keep an eye on them for a period of time before they make the decision to admit or not. So that's the observation unit. But over the next year, we'll renovate the main floor. And if you've been in the emergency department at the downtown hospital, you know it's cramped, it's crowded, it lacks some privacy, but we'll have all private rooms in there. Will give us more room for the doctors to assess emergency department patients and a better way for life squads to get in there. So that we think that the emergency department renovation is going to be a big deal. And finally, we're going to spend a lot of time, we'll be making announcements over this next month on an expansion of our whole cardiac service line. So the board here is supporting a vision for NCH to be a top 100 health system in America. Part of that is to really ramp up and expand cardiology services here. So you'll hear a lot more about what we're doing in cardiology. 2 weeks ago, we were notified by the Society of Thoracic Surgeons that we had achieved the 3-star rating. That's the highest rating they give cardiac surgery programs. It tells us that we're in the top 8% of hospitals in America for cardiac surgery. We're super proud of that. And we want to even add to that and expand that to a level that's greater than it ever has been. We found out at the same time that we are in the top 2% of all hospitals in America as it relates to critical care. So one of the blessings that we have here is that we've got 24/7 coverage by intensivists here, doctors that are in the ICU. So if you're critically ill, NCH is a great place to be because we've got these intensivists. Most hospitals don't have intensivists 24/7. We think that the combination of the intensivist with the expansion of our heart program is a big, big deal. And we'll talk more about that going forward. So with that, Bob, I'd love to open it up for questions, any comments, anything that people would like to hear about.
I think I'm unmuted here. There we go. Okay. Thank you so very, very much, Paul. Again, as I said earlier, I had a chance to hear you live, and you're just as good, good on the screen here. You really have done a lot, and especially since the last time I heard you anyway, COVID has really come forefront, and you've done an amazing job with that. And I was very impressed. I was actually taking my notes as I was going along here because so often people ask you, well, what's going on around town, or the old, some of the old theories about where to get all your medical care, and you've certainly developed a wonderful system here. Some of the questions are interesting because what we've received. One person just wants to thank you so very, very, very much. She said, a brilliant presentation. And I'd also like to thank you and your team for the superb care I received there in mid-January on the 5th floor of orthopedics. So be sure and pass that on. They must have done a wonderful job. I have a similar story of a friend of mine who was ill this summer, and even a former physician, and she just said she just couldn't believe the wonderful care she got. And it was a COVID deal and there for quite a while, but she just couldn't say enough about everybody, and your intensivists are so, they're 24/7, like you say, and it's a very, very positive thing.
You know, on the orthopedic, interesting, some people may not know this, but we have quite a bit of medical tourism of people flying into Naples during the wintertime to have total knees and total hips. We just had a few people discharged last week that I knew from Ohio that came here for their total joints. They get them rehab down here, because in Ohio right now, they're under a blanket of snow. Here, people can come get great care for their joints and then rehab here too. So that 5th floor has been amazing. So thanks for that comment.
Right. And you can see that we have I shouldn't say emphasize that, we have an age group that is maybe more prone to some orthopedic concerns. Let's put it that way. I get my injections on various joints as well. But I mean, this has really become a major center, and from total hips, total shoulders, everything else. And your facility is doing such a great job with it. That's wonderful. It really is. Another question.
The nurse leader that runs that unit, people may not know, but it's Suzanne Graziano, and she came to us from the Hospital for Special Surgery in New York. So they're one of the premier places they have joints, and we've incorporated a lot of that learning here, and we really have. That is an outstanding service line for NCH.
Wonderful. That's the kind of thing we love to hear. One other question that came in very early, but you're so good in covering your territory and your discussion here, is they were just asking, curiosity-wise, about the Naples Daily News facility and what you were going to do with it. And I think you answered that very well. It looks like that's got a lot of potential for a number of things. I don't know if you want to elaborate a little bit more on that, but that was a question that a person brought up early.
Well, that's a great community story too, because I got a call from Bill Barker, who was with Gannett one morning. He said, "Hey, Paul, Gannett's going to sell the building. They're probably going to package it up and put it in a real estate investment trust and just sell it to an out-of-town company, unless you can do something pretty quickly." So I was really proud that our team was able to get that transaction done over the course of about 40 days, which sounds like a long time, but for a transaction that big, it's quick to get the environmental and the appraisal and everything done. At any rate, the beauty is it stays now locally owned, locally controlled, and we're going to work with the school system and some other agencies here, because it'll be more space than we need totally. But I think if we collaborate with some training with the school system, local colleges, and then use the outlying real estate to develop something very innovative with Arthrex, it'll be a win for the community and for our employees that have been working in less than optimal space in Pine Ridge. They'll be in a much safer, better building.
That's excellent. And I know in a dovetailing to that description that you were giving us in your talk, you had mentioned about simulators and all the major things you can do. I happen to be an OB/GYN doctor, and simulators are so important for the laparoscopic and then the Da Vinci robotic kind of things that we were doing. But even when I'm back teaching pelvic exams and things to medical students, they've even got all those kind of simulated models and things that are very, very important for the training. And boy, I was really impressed when you mentioned 2,000 applicants. There are some programs across the country that don't even have enough applicants for the spaces they have. And here you've got an amazing number for now going up to 18 per year instead of 12. That's That's very outstanding for a program that's
So,
only been in existence, what, about 4 years, if I have it right, or so?
right, 4. So, doctor, and you can get this, but some of the non-clinical people, it's hard to fathom this. But I saw this mannequin. It's a woman that delivers a baby that's very lifelike,
Right.
and the baby is delivered then in some kind of fetal distress, and it's up to the nursing students and doctors to figure out what's going on, because the baby's giving off EKG readings and breathing sounds. And
Sure.
they told me that some of these conditions they can simulate are conditions that a doctor might only see 5 or 10 times in their whole career.
Right.
Here it is, they're going to teach these kids to what to do if it should ever happen. They'll have seen 5 of these before they even get out of their training.
Yeah, that's wonderful. That's really the thing we need to do, because you're correct. There are certain things. We used to say that there's 98% pure boredom in deliveries and 2% pure panic, and you want to be prepared for the pure panic time for a bad delivery. And that's outstanding. That really is good. But we're getting more questions now. You're stimulating the audience here too. Let's see. One was a question about how are COVID deaths reported when the primary cause of death might be just a stroke or heart issue or otherwise? They're just worried about that reporting and numbers that maybe influence our COVID deaths.
Good question. And it's been one that's been fairly confusing. I guess the first thing I would say is people have asked me, well, would there be any incentive for a hospital to report a death as COVID versus non-COVID? Is there any financial implication? The answer is no. We can't classify anybody as a COVID patient unless they tested positive for COVID. If we did that, it would be fraud, and we would be prosecuted for that. We would never do that. Yep. There is no financial benefit to claiming a death either, one way or the other. And on the question of, well, if a person has a stroke and a COVID, I guess in some ways this has always been a little bit confusing as to what was the true cause of death. Mm-hmm. But for the most part, I would say yes. If a person has COVID and is admitted to the hospital, and the doctor determines really the patient would have survived had it not been for the COVID, that's when they're classified as a COVID death.
Right.
So just to give us piece of context, I think we've discharged close to 2,100 people alive who had COVID. Wow. I believe our number of fatalities as of this morning from the beginning to right now, I believe the number is 139 folks have died from COVID. So that puts it in perspective.
That's very good, because there is a lot of misinformation and implications of cheating the system to try and get more monies, and you answered that very, very well. And I know that it's difficult to fill out a death certificate, and there's always certain collaborating factors that go into the cause of death, and you do have to list usually all of them, but how you rank them and what's going on, but there's no extra money going on in that at all. Well, one question that came up earlier, so you can defend this if you need to, is are you going to improve the telephone communication system at your hospital centers?
The answer is yes. And part of that too will be what I talked about, the ensemble piece, when you've had billing questions, where they have technology that are going to help us streamline that, because that has been cumbersome in the past, and we know we can get better at that. And we have just recently instituted a live appointment scheduling or assistance, where we have a call-in number where folks can get live help to get appointments and so forth. So the answer is, we know we need to improve the customer experience around appointments and billing, and then the ProScan imaging piece, that's a strength of that company too, to help us make this easy. We want to make it easy to get care here at NCH.
Excellent. That kind of goes along with that same person related, and I could just put it together here a little bit, is something about what might be going on then with the Pine Ridge building, and then something about parking too in the second deck of the Baker. So these people must get there often. Yeah, right. Anyway.
Yeah, the Pine Ridge building, we're going to be selling that, and we'll close on that transaction over the next month, probably 4 to 5 weeks. So we're just going to be switching out one building for another. But the Pine Ridge building is in need of significant repair, and it's not hurricane rated. So we can't have any information technology in that building. With the investment of Epic, we felt it absolutely imperative to make sure that's protected.
Sure.
The Naples Daily News building was originally constructed for and developed for somewhere in the $90 million range. We purchased that property for $28 million, so we felt like we were getting a real good deal that would be well into the future. We can stay there for a long, long time.
Right, and very multi-purpose, like you had mentioned.
Yes.
Collaboration with the community and so on. It sounds outstanding. That's very good. I appreciate those answers on that. Let's see. One was let's see. What are the technology implications as telemedicine increases? I know you mentioned about Epic is an asset with this, but just wondering about maybe a little elaboration on the telecommunication.
You know, that it's an evolving field for certain. And I think what I hear the doctors talking about when I go to meetings here, the clinical side of it, I think doctors are trying to figure out, where is telemedicine best used? There are still some things that don't seem to relate too well to telemedicine, but there are some follow-up things that seem to relate very well, where for a quick follow-up visit, rather than have a patient come back into the hospital or the doctor's office, we can accomplish that with telemedicine. And I think that's the going forward piece we have to sort out. What's the best way to use it? There are some, I think we're going to learn a lot more about the piece around behavioral health, mental health, and addiction treatment as it relates to telemedicine as well. And I'm anxious to see how the doctors and the behavioral medicine folks sort that out, because I do think one of the things we've learned in this pandemic is people really needed those services. How do we best deliver those services? And so we're going to be in communication with the Hazelton Betty Ford and with the David Lawrence Center, again, on how do we collaborate to do that piece of telemedicine best.
That's really crucial, and especially as we all hear and know and read, with COVID causing so much extra stress from young children to seniors, super seniors. Our grandkids calls them super seniors if you're over 90 or something like that. Yeah. So we're not quite there yet, but that's really, really crucial. And another question along that line is, one person just wanted to clarify where that NCH facility is now on Pine Ridge. Just wasn't sure where that was.
Gosh, you know, I couldn't tell you the exact address, but it's a big one-story building. I believe it was a retail store before that.
Okay, it isn't on the east side of 75. It's still on the west side of 75.
Yes.
Yeah. Okay, right there. Okay, gotcha. Okay, and anyway, I'm sure that it could be found. That was just a question on that. Another one is oncology being such a major part of your hospital. I usually would attend the tumor conferences on a regular basis for many years here volunteering, and it was an outstanding conference. It still is. I just don't get there now in person and so on. So the question is just anything that you're doing new in oncology at NCH.
You know, it's a great question. We just, during this pandemic, we engaged a group to help us develop a 5-year strategic plan. We just completed that process, but one of the elements of that plan is for us to look at oncology in a new way. And when I say a new way, this town really lacks what I call a comprehensive cancer center, a one-stop shopping where you can go and get coordinated care. And so we've already started talking to some of the doctors in town about this notion of maybe having a comprehensive center. And then, you know, we have satellite areas as well, but we really feel that this town deserves a place where people can go in one place. And again, with Epic and our moving to Epic, we think that a lot of people, even if they get their initial treatment at MD Anderson, Memorial Sloan Kettering, or Mayo, they can receive a lot of that follow-up treatment here because it'll be easier to coordinate the care through that record.
That's for sure. Those centers are really the tertiary care, whatever words you want to use for it, but that's the idea of the community all coming together, and we super subspecialists can do
Yes.
that aspect as well. So that's very good. Let's see. The other one here is pediatrics and infants. Is there anything special moving in the direction of that area?
Well, it's another a good conversation that is ongoing. We've been meeting with the community pediatricians over the past about 8 or 9 weeks to really get a lot of input from them. We're doing a lot of listening, and a couple of things are emerging from that. We've got a pretty robust pediatric emergency department at the North Campus.
Right.
We've got a pretty robust women's health, as you know. I mean, we do about 3,600 deliveries a year.
Mm-hmm.
And now we're trying to engage with the community private pediatricians to figure out what is it that they need, what is it we can do to be better partners with those caregivers. And we're getting some great, we have one of our physician leaders, Dr. Pia Myers, who's an emergency department in the PEDS emergency department. They're sort of leading that effort. And I think we'll get a lot out of that, where we can improve the overall level of care and broaden what we do in pediatrics.
Mm-hmm. Yeah, I could certainly speak to that. I've attended your pediatric or your obstetrical pediatric combined neonatal conferences up on the North Campus there, and they're outstanding, good discussions, and they're even nice, including some of the docs in the community like myself trying to keep up with things.
Good. Thank you for that, by the way.
Yeah, you do a great job with all that. Let's see. Oh, this is a good one. Is there a shortage of nurses and others like LPNs and so on? Where are we doing with that? I know you're talking about our numbers we have here and bringing it together, and that we didn't lose doctors this summer, but I don't want to elaborate on what you said, but that's the question anyway.
The answer is yes, yes, yes. There's a big shortage of nurses, and I'll tell you why, at least in the short run. Because of the pandemic, areas hard hit, and I'm thinking of areas in Texas, California, Seattle, Washington, the Pacific Northwest, have been hit hard with COVID. They've had a shortage of nurses. They have turned to the agency nurses, contract nurses. So they come to areas like Florida and offer to pay nurses upwards of $5,000 a week.
Wow. Plus
travel, plus lodging, to sign on for 12 weeks. So it has made the labor market for nurses very unstable. Mm-hmm. A lot of nurses have gotten on a plane and flown out to these places. And so we find ourselves now kind of scrambling a little bit. Mm-hmm. And at the same time, even though we've got great nursing schools in this region, there's a little bit of a shortage, not a little bit, there is a shortage of master's prepared nurses who are needed as faculty for these programs. So we are in communication with FGCU and Florida Southwest to figure out how do we work through this both in the short and long term to increase the pipeline, the supply of great nurses.
That's great. That's very, very important. And it's funny, in the years, many, many years, 40 some years I was in medicine, the ups and downs of that kind of cycle, that yes. They used to have even medium-sized hospital had their own training program for RNs and so on. And all of a sudden those went away. They went to the institutions, the larger institutions. Our daughter-in-law wanted to just go back for a nurse practicing after becoming an RN, but wanted to also be a practitioner. She had to get her PhD in nurse practicing, yes. Because now it's at a major university. She did it, but it's a different world out there. It makes it harder for training like that. So that's interesting.
It is, I would say, workforce planning for us and for most health systems in America is really a strategic priority right now. Mm-hmm. It's a whole different way of looking at the workforce, because you've got, in addition to nurses, you've got advanced practice nurses, as you just mentioned. You've got the emergence of physician assistants as key pieces to the healthcare team. You've got techs and you've got paramedics, all this mix of different providers. And how do we sort out these teams that are going to be the teams that give great care? That's the new thing that we'll have to work on in a big way.
Right. Well, I'm glad it's you and not me. It's a big job. It really is. Most of all the questions have just been little specifics about if you end up walking the halls at 9 or 10 o'clock at night, just checking how things are going was one cute little question here. Do you get in there late at night?
I do. I've done a couple things. So last Sunday night, I came in and rounded with the critical care team in the ICU because I wanted to just again see how they do that, the proning and the supination of the patients
Right.
that are COVID, because I'm just in awe of what it takes to get that done. I then really rounded on the medical surgical floors just to really thank the staff, see how they were doing, see what needs they have. And I think they like seeing, I'm not a medical doctor, but they like to know that that the leadership is interested in the frontline caregivers, and it inspires me to go. So I love it. I also, from time to time, put on scrubs and really just observe. So I spent some time up in the NICU up at the North Hospital 2 weeks ago, and on the mother baby floor, just watching how care is delivered and doing a lot of listening. So the answer is I do a lot of that.
That's really very important. I know even from a physician's point of view, and of course nursing and other personnel, it is very meaningful to see a president CEO out there trying to figure out exactly what they're doing. And as you're doing that, the thing that I get articles galore on is burnout in medicine, and it's all levels. It's not just the nurses, but the docs and early retirements, and maybe coming down here to Naples because no, anyway, but it's a major concern, and that kind of thing really helps them a lot. So that's,
well, and I think, from the standpoint of the United Church of Christ, I do, and I say this to people all the time, the spirituality piece is something we can't leave out of medicine, because I think it is the thing that keeps us resilient and keeps us looking at the bigger picture and what we can do to take care of ourselves while we take care of other people.
Thank you. That's a great way to conclude, because I think that's the reason the forefathers that started this 7 years ago and dragged me in because I was the medical person had thought that we have to combine both here and to try, and we're just not only medicine in our committee, we're kind of helping people adjust to their financials and long-term planning, even hospice, and we've had speakers from those areas and so on. So it's kind of difficult planning, but it's spirituality is such a basic part of it that we can't thank you enough.
Well, thank you. I'm honored to be invited, so thank you so much.
Yeah, wonderful. So I just want to end by thanking you, reminding people that get in their surveys so we know what to do next time and so on. We do have that this archive, so you can go online and get that through Naples UCC YouTube channel. And then next week, Dr. Stephen Schwartz is speaking. He's the director of the branch of Bascom Palmer here in Naples, and he's speaking on macular degeneration and cataracts. And the week after, the 17th of February, we have Deb Logan, the nutritionist, who's the executive director for the Blue Zone, speaking on eat better and live better. So we've got to eat better, live better, and spirituality. And thank you so much to know what the medical community is doing. We really can't thank you enough, Paul.
Thank you. And you've got two great speakers coming up. Dr. Schwartz and Deb Logan are both fantastic. So
Yep. We're glad to have them. So thank you, though. We're glad to have you. Appreciate it.
Thanks. Have a great day.
You too. Bye-bye.